At the inception of this administration, headed by His Excellency Senator Dr. Okowa, Deltans heaved a sign of relief, knowing that their welfare and well-being shall not be compromised. Being a trained medical doctor, grounded and seasoned administrator, he prepared the ground towards achieving a sustainable and achievable goal of providing a universal quality health care, leading to the reduction in mortality and morbidity rates, especially among children, aged, and the vulnerable. To achieve this laudable vision for the health sector, Governor Okowa appointed a vibrant and resourceful medical doctor, Dr. Nicholas Azenge, to oversee the Ministry of Health with the guiding principle of ensuring the availability of quality health care that is available, accessible, and affordable by all Deltans. 2 years into this administration, have this dream been realized? The Honorable Commissioner, Dr. Nicholas Azenge, explains.
I want to congratulate His Excellency Senator Dr Okowa. He established the Delta State Health Insurance Contributory Scheme, and the bill was passed. That is very important because it's an attempt to get health insurance for all Deltans and to get all Deltans to have access to quality, accessible, and appropriate technology health services. So that's one, establishment of the Health Insurance Contributory Insurance Scheme. And two, we then went on to establish the various boards that hitherto had been in moribund. The Primary Healthcare Development Authority Agency was established, and a board was created to run the primary healthcare services of the state. The state has 402 primary healthcare services, and the board that has been established will now go and look through all of them to revitalize them. One health center per local government at a time. Also, the Traditional Medicine Board has been established under this administration. Another important milestone, because hitherto a lot of people have been practicing these herbal and traditional medicines without any cost to the law. So now we have a Traditional Medicine Board. So much for the boards. The other existing boards, Health Management Board, was created by His Excellency, and appointments have been made. So we also have the Delta State University Teaching Hospital, Ogara, which is one of our major developments in the state. The board was created and the new CMD was brought in, and since the bringing in of the new CMD, that Delta State University Teaching Hospital is beginning to come back to its former glory. Delta State University Teaching Hospital was a place where we had a renal transplant done at a time, and things began to fall. But with the inception of His Excellency, that has been stepped up and things are getting better.
So the people of Asaba, and indeed residents of the state capital and its environs, the non-availability of a befitting hospital to care for their health needs has been a bit of challenge. So, when the administration of Chief James Nanefe Ibori decided to set up an ultra-modern hospital, the joy of the people knew no bounds. What are the efforts being made to ensure the completion of the hospital? Again, the Honorable Commissioner, Dr. Nicholas Azenge, throws more light.
Another big achievement of this administration system is the recommencement of work at Asaba General Hospital. Asaba Central Hospital has been moribund, and there has been no activity there for a couple of years in the past two administrations. This administration, despite His Excellency Senator Dr Okowa's cash resources, has paid up certificates that were owed to the contractors, and they are back on site. And they have promised to deliver that Central Hospital Asaba as a standard international hospital before the end of this year. Hopefully we shall be able to look for partners to help us equip it and run it as a standard international hospital. So Central Hospital Asaba is going to come on stream hopefully by the end of this year. That is another great major milestone and achievement.
Her Excellency Dame Edith Okowa The First Lady of Delta State is a caring mother who felt the need to contribute her quota towards the success of this administration, especially in the area of health care. She initiated a non-governmental organization known as the O5 Initiative. Through this vehicle, she has taken the awareness of the prevention and cure of sickle cell to the grassroots, letting the people know that a disease is not a death sentence, as hitherto believed. For to carry the message nearer the people, she established treatment centers in several parts of Delta State, where she gave pet talk to parents and victims, and also donated wheelchairs and other items to alleviate the plight of these sickle cell patients. Let us hear Her Excellency.
The establishment of this clinic in the state is one of our O5 initiative programs that focuses on the effective management of occupational distresses associated with sickle cell hereditary disorder. Talking about hereditary, the two doctors that have spoken to us today have talked much about it. There are some things I can break, there are some things I can't break. When they talk about hereditary, they say, this sickle cell, not be no fall from heaven. Now donation, I ain't make the pikin better. Man will be AS as a father, and the wife will be AS as a mother, will donate S. The other one will donate S, and the pikin will come get SS. And what I mean, distress. These children, most of them they go through so much stress in life. You notice when we were seated here, I noticed that so many people were crowded around them behind. And I don't crowd again, no. One address from them. Because of this stress, these children, one of the things that these children will hate is any environment that is stuffy. They need plenty of air. Mothers, I told you that I was going to speak much to you when you come here. In your home, make sure that where these children sleep is well ventilated. Not the stuffy place, they don't need them. They need air a lot. Hallelujah. The mission of the O5 initiative is in line with the prosperity agenda of this administration, aimed at giving hope to the hopeless and giving help to the helpless in transforming lives. There are some of these children here, they would never have been able to come here to do any genotype examination, that is test. But today, God has made the provision free. So many people are lining down there to test their genotype. It will surprise you, even amongst you very educated coppers. Some of you might not even know your genotype. It's true. So many of us went through marriage without even knowing whether we are AS or AA. It's only God that's made the magic for us. But this time around, now you have the knowledge. It is said that knowledge is power. Just walk in there. No person is taking any money from you. Check who you are. If you are AA, like the doctor have just told us, you are free to get married to anybody. If you are AS, you need to be careful. Except your faith will carry that love. Otherwise, if whatever love you are claiming, if you don't have enough faith, when the trials come, the love will collapse.
In the presence of the current dwindling economy and with the large expectation from the citizens, one begins to wonder if it is possible to meet the health demands of Deltans. What efforts has the government put in place to attract the private sector into a successful healthcare delivery, especially in the last 2 years of this administration? Dr. Nicholas Azenge, the Honorable Commissioner for Health, gives an insight.
We also have a MOU which we have signed with several organizations, but one of the most important is Novena University. Public-private partnership is something we need to encourage. So Novena University is opening a new medical school, and we're going to partner with them, with our hospitals. They will teach medical students in our hospitals, and we'll use their facilities, and that will bring a lot of development and increase in personnel for health personnel, specialized health personnel in the state. Also, we have Start Global, who is digitalizing our healthcare services. We have started with Oshimiri South as a pilot project, but the whole of the Western world is going digital, and we hope that we'll be able to digitalize all our healthcare services. So at some point, we will be able to just sit down and pick up medical records of patients if they are in Warri and they travel to Asaba and they fall sick. We should be able to pick up their records just by opening a computer and putting in some information about them.
Training and retraining, especially in today's world, where technology has taken the center stage, cannot be taken for granted. Therefore, the Governor Okowa's administration in the past 2 years has put this in the front burner to ensure that the operational hands of his healthcare programs are abreast with the present-day reality. To this end, series of training programs have been organized for both medical doctors, nurses, and other workers of the health sector. Dr. Mrs. Minnie Oseji is the Permanent Secretary in the Ministry of Health. Here, she delivers a lecture in one of the training programs, as well as other seminars that have been organized to refresh the minds of these health personnel.
Let's look at the Sustainable Development Goals in the health sector. A few of them. We have the main one, which is Goal 3, that ensures healthy lives and promote well-being for all ages. One of the indicators is that by 2030, there will be a reduction in global maternal mortality ratio to less than 70 per 100,000 live births. If you look at Nigeria's maternal mortality ratio, the last time we had the NDHS 2013, it was 576. Delta State is somewhere 100 and something. So now, in the Millennium Development Goals, we're talking about 75% reduction. So Nigeria was supposed to drop from 1,000 per 100,000 live births in 1990 to 250 per 100,000 live births in 2015, and Nigeria did not make it. And Delta State made it, but now it's no longer just per percentage. We are now looking at 70, a figure. So that's the magic bullet, that's the target that most of the developing countries are aspiring towards.
Immunization of children and pregnant women cannot be ignored by any responsible government that cares for the well-being of her citizens. In view of these obvious facts, the Dr. Okowa's administration has enshrined that all the periods set aside by World Health Organization, WHO, UNICEF, and other global health agencies are given adequate attention in spite of the lean resources available to the states. Here, the Secretary to the Delta State Government, Honorable Festus Agas, flags off one of the exercises at Owaliru in the Northeast local government area. In drawing global attention to certain health challenges, the World Health Organization, WHO, in collaboration with United Nations Organization, UNO, set some specific days aside, such as World Malaria Day, World Kidney Day, World Sight Day, etc., to create awareness on both preventive and possible cure for these ailments. In all these days, radio and television broadcasts are made to celebrate them. Here, the Honorable Commissioner for Health, Dr. Nicholas Azenge, and the Permanent Secretary, Dr. Mrs. Minnie Oseji, addressed the state on World Sight Day and World Malaria Day, respectively.
This is aimed at increasing global awareness on the importance of good vision and prevention of avoidable blindness or visual impairment. The WHO global call to action for this year is Universal Health with the theme Stronger Together, a call to ensure everyone, everywhere has access to eye health. This call is in keeping with the Health for All Deltans, HIFAD, a vision of Governor Senator Dr. Okowa's administration. Despite the present economic climate of the nation, this administration is striving to ensure that the health in general and eye care in particular still remains available, accessible, affordable, and equitable to all Deltans. The physical, financial, social, and psychological burden of visual loss to the individual, family, and society remains catastrophic. The importance of sight cannot be overemphasized, especially now as the state is advocating for self-sustainability through indigenous innovations and diversification in various sectors of the economy. All hands need to be on deck to pull this nation and the state from the present economic recession. The international community and world leaders have recognized the fact that to achieve success in sight, preservation, and restoration, all stakeholders involved in eye care need to collaborate effectively. The government urges all eye care providers in the state, which include ophthalmologists, optometrists, ophthalmic nurses, opticians, and other eye care workers, health counselors, community health extension workers, school teachers, parents, caregivers, traditional and religious institutions to continue to play their various complementary roles effectively. Those who are leaders must show leadership, dedication, and accountability in providing eye care in Delta State.
Fellow Deltans, it is my pleasure to address you today as the entire world commemorates World Malaria Day. 25th April is a day of unified commemoration of the global effort to provide control and end of malaria around the world. World Malaria Day represents a chance for all of us to make a difference. Whether you are government, a company, a charity organization, or an individual, you can roll back malaria and help generate broad gains in multiple areas of health and human development. The theme for this year's celebration, End Malaria for Good, reflects the vision of a malaria-free world set out in the Global Technical Strategy for Malaria 2016 to 2030, adopted in May 2015 by the World Health Assembly.
No doubt, the numerous achievements of His Excellency Senator Dr. Afo Okowa in the area of health care in the last 2 years cannot be captured in a program such as this. Suffice it to say that Deltans are indeed in safe hands, and the prosperity to all Deltans, as enshrined in the SMART agenda, is worth applauding. Let us hear from the Honorable Commissioner for Health, Dr. Nicholas Azenge, what to expect in the years ahead.
The plan for the administration going forward is what we call improvement of healthcare. But now we have to be specific. How do we improve the healthcare of the people? So first, the registration of all Deltans and in the state is going to be aggressively pursued. So if everybody has a card and ability to access healthcare, then that is a big process. So when people can access healthcare, then the next thing is how do they, the hospitals they go to, how do they look and how do they, what is the quality? So obviously we'll then have to improve the quality of our hospitals, and we have to take it a little at a time. So currently the work plan is that if we can do one primary healthcare center or local government per budget year, we'll be in good shape. That will give us 25. The federal government has promised to do 10,000, which means that they will do one primary healthcare center per ward.
Deltans, as we celebrate 2 years of our amiable governor, Senator Dr. Afo Okowa, in office, Let us embrace the numerous programs lined up for our well-being, especially the health insurance scheme, O5 initiative of the First Lady, the various immunization schemes and advocacies to eradicate all forms of diseases so that we can be healthy to contribute our quota towards the development of Delta States. Congratulations to Ekweme One, our dear governor, on your achievements in the state health sector.